Can everyone hear me in the back? All right, thank you. And thank you for that introduction. I'm Irene Chan, as mentioned earlier. I'm the Deputy Director in the Division of Medication Error Prevention Analysis, and I'm really happy to be here today. These forums, they offer us as representatives of the agency an opportunity to share with you what we're thinking, what we're seeing, but really there's a lot of value for us as well because we get to hear a lot of different perspectives, and I'm able to bring that back, share that with my colleagues, and that helps to inform what we're doing tremendously, so I appreciate being here. So we're going to talk today about labels and labeling. And we're going to talk about designing for patients and FDA's perspectives around, what we're looking for when we talk about good design of labels and labeling, because ultimately what we're hoping is that translates into safe and effective use of the medications that are out there, safe and effective understanding of how to use them, safe and effective understanding by the patients, which is critical as well. So there's patient labeling components. There's also labels and labeling that are really targeted more for the provider so that they can share information subsequently with their patients as well. So we're going to get into a little bit of all of that. And I'm going to start first by talking about the definition of what is a medication error. I'm not going to read this for you, but what I want you to focus on is the key words that are underlined and in red. That whole idea about a medication error is we're trying to prevent something. We're trying to prevent an event that could lead to this inappropriate medication use or patient harm. And in 2006, some of you may be familiar with this, with IOM recommendations. What I want to focus on is the fact that, even today we see that there's still a lot of labeling and packaging issues that cause medication errors. And, there was a lot of emphasis, both historically and presently, to urge FDA to use human factors analysis to improve the labeling information that's out there that prescribers rely on, other healthcare providers rely on, that patients rely on. So that brings me into, well, what exactly is human factors? Human factors, when you boil it down, it's really about understanding the interactions between humans and some element of a system. So for our purposes today, that system element is the labeling. But the idea ultimately is to get to this goal of optimizing human well-being and overall system performance. When we think about putting those concepts together, then medication error prevention as well as the human factors, what we see is they're really interconnected. Because if we want to prevent medication errors, we have to be critically looking at the human factors. And ultimately, with the combined goal of ensuring that there's appropriate medication use and that we are optimizing human well-being. So with human factors, the idea is that you can apply a process to the design of whatever the system in this case labels and labeling, and you can go from something that might be higher risk and ultimately decrease the risk level. So I'm going to talk a little bit about some of the guidances we have out there, and I'll sort of underscore the point that a lot of this comes from the patient experience, the reports we get from manufacturers, direct reports from patients, healthcare providers in the field, and what they're seeing. This helps the agency to learn and then inform the recommendations that we make to the manufacturers when they're designing their labels and labeling. So some general considerations is we always encourage when companies are developing their labels and labeling, they need to really understand that end user. So if that end user is a patient or a caregiver or a healthcare provider, they need to understand who are the people they are designing for and where are the environments in which these labels and labeling or whatever is the system is going to be used. We want sponsors to assess and obviously minimize the risk for medication errors that could be attributed to labels and labeling or poor design of labels and labeling. And then, we encourage the use of human factors and gathering data, through human factors studies to help characterize the risks and develop risk mitigation strategies. And when we talk about a human factor study as compared to a clinical study, generally you're talking about in contrast to clinical studies, you're talking about studies that are generally small in size, short in duration, as compared to these clinical studies. And it's a relatively small investment of resources, frankly, that can avoid the need to resolve issues post-marketing. So I talked before about the importance of considering the end users during development. And in a lot of cases, we're talking about products where you have multiple end users. That same product is going to be used in that 5-year-old just like it's going to be used in a 65-year-old. And we have to understand all of the differences in the distinct patient populations and how that's going to impact how we design the products and their labels and labeling. So, we have to understand, based on this indication that the drug is seeking, are there going to be vision impairment considerations, hearing impairment, tactile sense impairment, strength, dexterity, comorbidities, et cetera. The list goes on, that can affect how a user is going to interact with the labels, the labeling, the packaging that's going to be put in front of them, and how it's going to affect their ability to comprehend the information put in front of them. The other thing is to think about where the products are going to be used, especially when we think about patients as a user group. Our patients, and I think to get to some of the earlier points made this morning in the first panel, which was excellent, these are human beings that are living lives. They're out there, they're using meds. They're not sitting in their home every time they need to take a medication. They're going to be out, they might be on a camping trip, they might be traveling. So we need to understand what are the environments that people are using these products in. So moving on to another guidance. This was a draft guidance that was recently published in February. It's human factor studies and related clinical study considerations in combination product design and development. And, when we talk about human factor studies, there's sort of two main buckets. We talk about formative studies, which is the design process that is iterative in nature. You're taking perhaps you're rapidly prototyping, and you may not have a final finished form, but you're using different models and working through them to understand, how do I continue to refine the labels and labeling? Validation then is you have what you believe is ready to hit the market. So you think this is what you want to be on the shelves, and what the FDA is seeking then in those cases is data to support that that's the case, and that's where the validation study comes into play. So the idea is we want to apply these iterative studies so that the labels and labeling are continually optimized to support safe and effective use. The goal is to optimize patient understanding of key information that's conveyed in the labels and labeling, or the knowledge tasks, as we would call it, or some would refer to the labeling comprehension aspects of it. And to understand fundamentally that the labels and labeling are part of the user interface, in addition to the product itself, the packaging, many other components. But I think it's also important to remember that labels and labeling by themselves aren't going to replace the need for good product design in the first place. So trying to use labels and labeling to overcome, if you will, the weaknesses in something that may have been poorly designed is not really the strategy that the FDA is looking for companies to take. So when we talk about which product to evaluate in these validation studies, what we're expecting manufacturers to do is really to study what they intend to put into the market and what they intend to submit in that marketing application. And so we expect them to be evaluating the entire user interface. And when I use the term user interface, I'm talking about all the connection points where a user, such as a patient, is going to interact with that product. So it includes the product itself, it includes the packaging, it includes all the labels and labeling that go on it and accompanying it. So in terms of validation studies, what we ask companies to do is to look at evaluating these products using representative users, the actual users who would use these products themselves in the market, and walk them through the use tasks or the scenarios of using the product, and identify what are the areas that we see people are having difficulties with. Where are we seeing observations where there may be errors that are occurring? And basically be able to dig down and say, okay, we observed this happening. We want to understand why it happened, get at the root cause of it. So if the root cause is, there was this graphic on the instructions for use, and it wasn't very clear to me. The graphic made it look like I was supposed to make a twisting motion. I didn't realize I was supposed to pull instead. Those are the types of things we're looking for with that root cause analysis, to understand, well, how can we improve that? How can we apply something in terms of an edit perhaps, or some other approach to ensure that we're optimizing that interface? So the knowledge task studies, which I touched on before, this is used when we want to understand certain information that's conveyed in the labels and labeling that are critical. There are some things that you cannot directly observe. I can observe someone as to whether they can hold an injection in place, but I may not be able to observe whether they understand if they have this particular indication or contraindication, or if they are actively bleeding, whether they should proceed with using the product. So those are critical messages that are part of the labels and labeling that we want to understand. Do people actually understand this? Do they know what to do if they see this? And it can be part of both the formative and the validation work that's carried out by manufacturers. And again, it's focusing on understanding and interpreting the important user interface information. So in terms of who evaluates this data when it comes into agency, it is DMEPA, the Division of Medication Error Prevention Analysis. So when it comes into CEDAR specifically, we are the folks that are looking at this, but we don't look at it in a silo. We do also have input from other groups within the agency, and I have a colleague here from the Office of Medical Policy. So for example, when there are instructions for use that accompany a medical product that a patient would have to follow instructions for, we're going to be reaching out to our colleagues in OMP because they're giving us insight as well and ensuring that those instructions are readable, they're appropriate in terms of a grade reading level, things of that nature. So this particular, the Office of Medical Policy in particular, their patient labeling team helps to ensure that the patient information uses formatting and other techniques to help patient readability, that we're using simplistic words and concepts to help patient comprehension, that it doesn't include unnecessary or redundant information that may ultimately lead to users losing focus of what they need to pay attention to, and that has an appropriate reading comprehension level, and of course is consistent with the prescribing information. Also, the team looks at the following forms of information that you see listed here. So the patient package inserts, or PPIs, as they're sometimes referred to, the medication guides, the instructions for use, as I mentioned. And in terms of moving patient information forward, patients need to receive clear, actionable information in order to use their medications safely and effectively. And the FDA is really committed to developing a new form of patient information. Some of you may be familiar with this. It's called the Patient Medication Information, or PMI, and it's to help ensure that patients receive essential information about prescription medications. So basically, FDA is proposing to amend the medication guide regulations to require this new form of patient labeling, the PMI. And in terms of the patient medication information framework, this information would provide clear, concise, written patient prescription drug product information. It would be required for human prescription drug products used, dispensed, and administered on an outpatient basis. The idea would be to have a standardized format. It would be submitted to FDA for review and approval. It would be distributed to patients who receive prescriptions. It would be intended for use at home, not to replace or impact the professional labeling or instructions for use or patient counseling, of course. It would be freely available and easily accessible to healthcare providers and patients, and it would be consumer tested during development. So in terms of some recent activities and next steps, there is information about the PMI proposed rule that was published. There is a link here that you can visit. And we're continuing to engage as an agency with interested stakeholders, and we're continuing to work on that proposed rule for PMI. So there are some additional resources listed here, and hopefully I've been able to give you some insight into what FDA is doing to address patient understanding of the literature that comes with their medications. Thank you.